Thank you very much and good afternoon. As of today, we have now reached 76.5% of all adults being immunized here in British Columbia, and 74.8% of everyone 12 years of age and older have now received their first dose of vaccine. So we've delivered 4,231,871 doses of all three COVID-19 vaccines to adults or to people here in British Columbia, and of those 768,008 are second doses. So we are pleased to see that across the board first doses continue to progress well, and we've now, as we talked about earlier this week, our health authority teams are using many creative tools to make it as easy as possible for everyone 12 and over to get the vaccine and to protect themselves and their communities and families here in BC. As well, our second doses are accelerating with invitations going out to tens of thousands of people every day now, and those clinics are active across the province as well. In terms of the transmission of disease in the province, we have 120 new cases today, bringing the total number of people diagnosed with COVID-19 to 146,794 people. Of the new cases, 13 are people who live in the Vancouver Coastal Health Region, 53 people are in the Fraser Health Region, 5 people are on the Vancouver Island Health Region, 43 people live in the interior, 5 in the Northern Health Region, and 1 is a person who normally resides outside of Canada. We currently have 1,451 active cases, 131 of them in hospital, 44 of those people in critical care or ICU, and 143,579 people are now recovered. Sadly, in the last day, we've had 1 additional person die from COVID-19, a person in their 80s who unfortunately died at the outbreak in the Richmond Hospital. Even though that outbreak is over, we know that the impacts can be felt for many weeks after. That leaves 1,739 people we've lost to COVID-19 in British Columbia, and our condolences go out to their families, their communities, and care providers across the province. The outbreak at Charrington Place in Fraser Health is now over, and that leaves us with 3 active outbreaks in long-term care and assisted living right now. So as I've mentioned, our vaccine program continues to go full speed across the province. I will say today we were notified that there's some upcoming challenges with the delivery of Pfizer vaccines in July. And as a result, the supply that we will be receiving in the first 2 weeks of July is now, we've heard, will be reduced. So that is something that happens when we're in a global pandemic with a global vaccine supply. We know these speed bumps happen, and while disappointing, they're not unexpected, given the complexity of the global immunization efforts. So we will continue to work with what we get and be sure that there will be enough vaccine for everyone. And we don't expect this to affect our timelines. We hear that the decrease will be in the first 2 weeks of July, and that they will be making up the increase in the last 2 weeks of July. But it does mean it's a reflection of the challenges that we've had across the board. We know that primarily this has been with Moderna, and we've had challenges with shipments. Thankfully, very recently, we've had an indication that we're going to get a lot of Moderna starting this week, so that is good news. And we know that both the mRNA vaccines that we have, Moderna and Pfizer, are both equally safe and effective. If you receive the mRNA vaccine for your first dose, you will normally and usually be offered the same vaccine for your second dose. And that is our policy across all of our clinics. We do need to recognize, however, that sometimes you may be offered the other mRNA vaccine. The vaccines we know are very similar, and they're equally effective. We do our best to make sure that both products are available at every clinic, but as I've mentioned, sometimes supply issues, when we have this rapid just-in-time response, we occasionally do not have the same product available for everybody. As I mentioned, these are both safe and effective, and according to our National Advisory Committee on Immunization, can be considered interchangeable. So that is to reassure people that if that occasion happens, when they don't have what the initial vaccine that you were given for your dose 1, that it is perfectly safe and equally effective to receive one of the other mRNA vaccines, so Pfizer and Moderna. I will also say that the call center agents don't have the information to know which vaccines you will receive at any particular day on any of the clinics. As you know, we're immunizing 60,000 people a day, and it is very much a challenging game in a way to make sure that we have enough vaccine for every clinic with the shipments that are coming in on a periodic basis. So just be rest assured that we will do our best to make sure you get the same vaccine that you had for your first dose. But getting 2 doses of the vaccine is important for all of the vaccines that we have here in the province, and we encourage everybody to get that second dose as soon as it's available to you. As well today, the National Advisory Committee provided some updated guidance based on expert opinion around mixing and matching of different types of vaccines. So this is particularly around the AstraZeneca vaccine and a second dose for AstraZeneca vaccine. I've reviewed this statement, and it is something that is not surprising to us. It's based on some preliminary data from a study that was done in Germany with a small number of people. And what it is based on is measuring of the immune system response. And it showed that people who had an mRNA vaccine after a dose of AstraZeneca had good or better immune markers afterwards. So this is a very small study. It adds to the information that we know. But we've weighed this data along with the real-life data that we see about how well these vaccines protect us. And does that little bit of extra antibody or those the cell-mediated response translate into better protection in the real world? And the answer is we don't know that yet. And we still know from the information that we're seeing, both here in BC, but also primarily in the UK, where a lot of AstraZeneca has been used, that vaccine effectiveness is very good for both AstraZeneca and the mRNA vaccines. It's important to remember that this is new information, that we are continuing to learn as we use more of these vaccines around the world, and as more studies are done to help us understand which vaccines, which combinations work better, and which intervals work better. And we've talked about that a little bit before, where we've seen now that it probably works better to have a longer interval versus the short interval that was used in the clinical trials early on. But the bottom line is the very real-world experience and evidence shows us that we have good protection across the board with both vaccines in our community. Both approaches are highly effective, but mixing an mRNA after a dose of AstraZeneca may give some boost to the immune system, but we don't know whether that translates into whether you're better protected or not. We don't know that definitively, and we may not know that for some time. As a result, here in BC, our advice has not changed. You make the choice that is right for you, because all the vaccines that we have here in use in BC are safe and highly effective, and so are all of the options. We will continue to watch how all of these vaccines are working, and there are additional studies underway, so more information will come up, and we'll let you know if we change this information. But I think we can be very reassured that 2 doses of whatever vaccine you receive are safe and effective and work here in BC. And we will continue to watch the ongoing studies about what is the optimal interval, how long does that protection last after you've got your second dose. And those are things that we'll be watching very carefully as we go into the fall. There are studies ongoing looking at whether we need a third booster dose, whether it needs to be modified a little bit to account for some of the different strains or variants of the virus that are circulating. And we're watching those studies very closely too. And if it does turn out that sometimes people's immune response wanes or lowers after a period of time, then we will be providing a third booster dose with the mRNA vaccine if needed. So these things change. We're learning as we go, and we're learning lots of very useful information about how vaccines affect our immune system and how long that immunity lasts. And we will update information as we go. I just want to also say that throughout this whole pandemic, our public health teams, especially our environmental health officers, have been working very closely with WorkSafe BC and played an important part in our pandemic response, supporting businesses to have the comprehensive COVID-19 safety plans that we started with our first restart program over a year ago. Those plans have been the basis that have allowed us to keep many businesses functioning, even at reduced capacity, over the last 2 waves of this virus that we've had. These plans have helped to keep employees and workers and customers safe. Now, as we move through our BC Restart Plan, we'll be taking the lessons we've gained from having these types of specific plans in place. And as we move to Step 3 and 4, businesses will be adapting these COVID-19 plans into a more general measures to keep people safe from communicable diseases in workplaces. So Public Health and WorkSafe BC will help workplaces to make this transition, and then we will be providing detailed guidance on these general communicable disease plans in the coming weeks. Businesses will need to have these plans in place for as we move through Stage 3 and into Step 4. Most importantly, will need to be in place before we hit the respiratory and other communicable disease increases that we tend to see in the fall. So COVID-19 safety plans, once we get to Step 3, will no longer be required, except where there is elevated risk. And I do recommend that businesses look at what are the layers of protection that they can keep in place in preparation for the unknowns that we may be facing this fall. For example, barriers and signage and other things. Just to say, WorkSafe will have much more information based on the work that we're doing together with Public Health in the next couple of weeks as we look to Step 3. Our progress through this pandemic in BC has always been the result of us working together, doing our part, and supporting others to do the same. We've done things right, and we've done the right things, and we need to keep going. As we bridge to brighter days of summer, let's continue to safely restart, slowly and with respect for others, recognizing that not everybody is in the same level of comfort yet, but that we can put this pandemic behind us. Let's make sure we encourage everybody to get their immunizations. That is the tool that we have now that gets us out of this pandemic, both your first and your second dose in the coming weeks. And let's get our transmission down as much as we possibly can so we can enjoy the summer weeks ahead. And let's, of course, remember to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry, and I wanted to start by acknowledging the person that passed away in Vancouver Coastal Health Authority. As Dr. Henry has said, at Richmond Hospital, this pandemic has been very hard on everybody, but obviously on families who've lost loved ones directly related to COVID-19 or lost loved ones in this pandemic for any cause who have not had sufficient opportunity to grieve. So I want to pass on to that family both my condolences of the government, of people in BC, and to their friends and their caregivers and their communities. Obviously, it was another very strong day of immunization in BC. From yesterday to today, 66,729 doses delivered. I want to acknowledge the work done by our pharmacists who are delivering second doses now of AstraZeneca, and in fact to date in the very short period of time since we opened up second doses have provided 63,910 second doses and well over 300,000 overall doses to people across BC of AstraZeneca. I think our pharmacists have really stepped up and done an excellent job, and we are extremely grateful to them for all of their efforts. With respect to immunization, as Dr. Henry has said, there has been some changes in vaccine delivery from the federal government and will be in the month of July. And just to put that in context, I want to say that the federal government continues to work very hard to deliver vaccine to BC, and that our job consistently is adapt to that. As you know, from the end of last week, the beginning of this week, we saw and are going to see significant new supplies of Moderna vaccine, and we are exceptional team who deliver vaccines everywhere in BC, led by Dr. Penny Ballum. We're obviously adjusting and adapting and working on that, and now we have, in terms of when vaccine is going to arrive, Pfizer vaccine going to arrive, a few more changes, and we're going to continue to adapt and to deliver this largest vaccination program in BC history to people and communities across BC. Just to show the difference in what we're seeing and expecting to see in the coming weeks. Next week, with respect to the Moderna vaccine, first of all, at the end of the week that we're in, 392,420 new doses. Next week, at the beginning of the week, we're expecting 378,420 doses and 382,760 doses of Moderna. So that is a significant increase. We don't have any right now guarantees or a sense of deliveries in July, but we expect obviously more Moderna in that time. So that's a significant increase in the amount of Moderna we're receiving in the system. With respect to Pfizer, the week we're in, we've already received the 327,600 doses we expect. The week of June 21st, from the federal government, our supply is again 327,600. At the end of the last week in June, starting June 28th, it will again be 328,770, so the same range. The change will be the following week, the week of July 5th. Initially, the expectation was that we'd receive a further 308,880 doses. The federal government has now indicated that we will be receiving 121,680 doses. With respect to week 31 of the campaign, which starts on July 12th, we have the same indication that we'll see a reduction in doses, and then by the end of July, we'll make up those numbers. So this has some effect on what we're trying to do, but if you look at it from 10 days ago, with respect for the people working so hard at the federal level to deliver doses to British Columbia and to Canada, because of the increased amount of Moderna, we're doing well. We obviously would rather have vaccine here than not, but we're receiving a significant amount of vaccine, and this is the time, if you haven't registered, if you haven't booked, to register and to book. And in dozens and dozens of communities across BC, there are first dose, walk-up vaccination clinics available. So check your health authority websites because they're everywhere. And it was wonderful to see the big line of people in Fort St. John this past weekend, and the efforts being made by BC CDC staff, Northern Health staff, and the community in Fort St. John. I want to acknowledge my colleague in the legislature, Dan Davies, for his work in assisting us with those efforts as well. And just finally, I want to just bring you up to date on the most recent surgical renewal numbers. You'll know that last week we reported that all 9 hospitals were back to full operation by June 7th, and we've affirmed the commitment to get those individuals whose surgeries were postponed. That commitment is clear, that we are going to do everything we can to get those surgeries underway as soon as possible. I want to note that for the week of May 31st to June the 6th, our most recent week, health authorities completed 7,471 surgeries. This was in the midst of the slowdown, and it was one of the largest weeks of surgeries we've had, which is a tribute to everyone working in the health authorities. That is actually higher than the average of the previous number of months. Just finally, I'd say this, that this week the Premier announced our move to Step 2 of BC's Restart Plan, our advancement through the 4-step plan to bring us all back together, and our progress in getting patients their surgeries that were postponed and fundamentally changing the way we deliver surgeries in BC are each anchored in the countless steps each of us take to make our better future possible. I want to acknowledge what everyone is doing throughout BC and continues to do. It's the step we're taking each day to build our immunity by registering for our first and second shots, by booking our appointments, and by getting our vaccinations. It's the determined steps we are taking each day to ensure our safety, including in workplaces and especially in workplaces, and protect our immunity by using our COVID skills, by following the guidance we've been given, and by adhering to the orders that help us stop the spread. By continuing to focus each and every day on the individual steps we take and collective steps we take to keep safe and stop the spread, we remove anxieties from patients by getting them the surgeries they need, and we build a welcome future that has much in store for all of us.